My name is Becca. I'm a student at Webster University in the Nurse Anesthesia program. Today I'm going to be talking to you about supraglottic airways. A supraglottic airway is an airway device that is used when encountering or anticipating a difficult airway. These devices are used very early on in the ASA and DAS difficult airway guidelines. So let's talk about them, how to use them, when not to use them, and then I'll show you how to use them on a patient, okay? So times when you should not be using a supraglottic airway would be patients that are at high aspiration risk, that are full stomachs or could aspirate during the surgery. These devices, the patient could aspirate with these devices. The airway is not fully secured, so if that is the case, then go ahead and put a general with an endotracheal tube in just to protect the airway, okay? The other times when these devices aren't the greatest are for longer surgeries that are hours and hours and hours long. At that point, you would just want to protect the airway in that situation too, and intubate. And they're also not recommended for positive pressure ventilation, because if you get over a certain amount of pressure, you can insufflate the stomach and then increase your risk for aspiration again, okay? So now that we've discussed when you shouldn't use them, when you should use them, one of the benefits to them is that the patient can breathe spontaneously the entire time while they're in place. So you would also use these when you were having trouble masking a patient and you needed to oxygenate and ventilate them. You would use them, you can use them as your primary airway management for anesthesia. And you can also use them as an E2 tube pathway for endotracheal tube placement, okay? So first things first, whenever you're going to use any sort of airway device, you're going to want to make sure you've got your basic safety skills and things set up. So you're going to make sure you've got a suction in the room that it's functioning, working and on, okay, at all times. And then you're going to want to make sure you've got some lube to lubricate the back of the device. And then depending on what kind of device you have, whether it's a first generation LMA that has a cuff or second generation iGel that doesn't have a cuff, you're going to make sure you've got a 10 cc syringe so that you can inflate the cuff if you have it or not, okay? And you'll be able to tell. And the last thing you're going to want to have with you is a tongue blade or a tongue depressor, just to get the tongue out of the way for insertion. So to get prepared, before we even start to talk to the patient, do a thorough airway assessment. We're going to make sure our safety things are in place. And then we're going to want to lube the back of the LMA. So we're going to want to put the lube on these devices on the back here. We want to avoid putting lube around the sealing part of the airway, because that will hinder your seal so that you won't get good adequate volumes. So you would avoid putting lube down here. You would only put lube up here, okay, on the back. So now that we've got our LMA prepped and ready, that's pretty much all the prep we need to do to get ready for the patient, okay? So now we're gonna take this over and we're gonna put this LMA in our patient, all right? So first things first, we're gonna wanna scissor the patient's mouth open. I usually like to scissor with the tongue depressor just to make sure the tongue is out of the way, okay? So we'll scissor the mouth open. We've got our LMA already lubed and ready. We're gonna take the LMA, and this side should be down. We're gonna insert the LMA in here. And it may take a little bit of pressure to get the LMA fully seated. And we're gonna place the LMA in. At this point, I'm gonna take the tongue depressor out. One thing I like to do when placing my LMAs is to get behind the mandible and jaw lift like this while pushing down on the LMA to fully seat. Just like that. Now that the LMA is in place, the patient can breathe on their own. We're gonna hook up our airway circuit so that we can give them oxygen while they're breathing spontaneously. We can also deliver anesthetic gases through here. Things we're gonna wanna look for is we're gonna listen, and we're gonna make sure we don't hear any air leaking or kind of a bubbling sound coming from the seal around where the LMA sits. If this happens, you may need to insert deeper further into the patient, or you may need to come back. It's kind of a troubleshooting thing, so you're just gonna see what kind of works. Other things I've done is I've kind of manipulated here just to help it seat a little bit. But now that you've got your LMA in place, you're going to want to make sure when you go to remove this LMA that the patient is still under enough general anesthetic that you can safely remove this LMA without them biting down so that you're unable to get it out. Or you're going to want to wake the patient fully up so then they follow commands and can open their mouths enough so that you can remove the LMA. Okay? Thank you for watching our video.